Hello, in this video, I'm going to be talking about alcohol during treatment for breast cancer. Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content, so there's always something new to watch. I'd also love to invite you to go to Yerbba.com to get your personalized Yerbba report. Alcohol. This is an interesting topic because what we've been told for many years turns out not to be true, and that is that alcohol in moderation is fine. So we've been told, at least I have growing up, that no more than 1 drink a day for women or 2 a day for men is safe and may even be protective in terms of protecting the heart from things like cardiovascular disease and heart attacks. More recent evidence has shown us, however, that alcohol is really unsafe in any amount. And there are lots of reasons that the evidence has changed and that recommendations have changed. It can be hard to hear that alcohol is unsafe in any amount. And when you're going through treatment, at least in the past, many physicians would tell patients, of course, enjoy your glass of wine. What we've learned, though, and what we're acknowledging, and this is one way in which we change and grow as we learn, is that alcohol interferes with your body's ability to repair after treatment with things like chemotherapy or radiation therapy. And that while your liver is busy healing from the alcohol insult, because alcohol really is a toxin, it's not metabolizing chemotherapy out of your body. Now, I have to say that we generally don't see major problems during chemotherapy, but that the fact that there's an interaction means one should be cautious. Now, alcohol can also elevate your liver enzymes, especially if you have more than 1 drink and if you're a woman. I once had a patient who was all set to go on a clinical trial, but her liver function tests were abnormal. And that leads to a whole host of tests, repeat blood work and scans. And when I asked her, have you had more alcohol lately than maybe 1 glass of wine? She told me that indeed she had, that she and a friend had killed a bottle the night before while she was getting ready to get chemotherapy and start on the trial. This is an extreme story where she had 3 or 4 drinks before starting chemotherapy, but to a lesser extent, we can see this in people where 1 or more drinks can irritate the liver, and that's really what we're measuring when we measure so-called liver function tests. We're measuring how free and clear is the liver. Now, when the liver looks irritated, it's a sign that there's some temporary or perhaps even permanent liver damage. And of course, it would make sense not to do that when we're relying on the liver to get rid of chemicals in the body, including chemotherapy. Most chemotherapy is metabolized by the liver. If the liver is busy metabolizing alcohol and healing from it, it's not going to clear the chemotherapy and the byproducts of chemotherapy as well. So chemotherapy is one important treatment during which alcohol really should not be advised. What about radiation therapy? Well, a similar thing can be said, that alcohol interferes with cells' ability to repair. And this isn't cancer cells' ability to repair themselves. It's your normal body, like your eating tube, your esophagus, and your mouth and your throat. So think about alcohol that we use to sterilize a surface. It kills everything. It kills living cells like bacteria. And you can imagine that drinking alcohol could do some of the same thing. Now, of course, you're not soaking your throat in alcohol, but I think you can see the point. With endocrine therapy, like aromatase inhibitors and tamoxifen, those are also cleared by the liver, meaning when I say cleared, I mean gotten rid of by the liver, as opposed to the kidneys or through the breath. And we want to make sure that the liver is as fit and healthy as it can be. And alcohol can decrease the health, even if blood tests are normal.
Diagnosed with breast cancer? Meet Yerbba, your guide to personalized treatment options. Each option is specifically tailored to the unique characteristics of your tumor. Sign up today at Yerbba.com to take control of your breast cancer journey.
In addition to thinking about how alcohol interacts with treatment, one other key thing to know is that there is more and more compelling evidence that alcohol increases the risk of recurrence. And we think it does this because it alters estrogen metabolism, but we're not entirely sure. We don't really know how alcohol does this, but it appears that it does. It appears that even 3 drinks a week, which is less than a drink a day, can increase the risk of breast cancer recurrence, especially with hormone receptor positive breast cancer, which most breast cancer is. So I know we're talking about alcohol during treatment for breast cancer, but a really good reason to think about modifying your relationship with alcohol is because it's something you can do to do anything you can to decrease your risk of recurrence, regardless of the hormone receptor status. Now, stopping alcohol is really hard. It's hard for a few reasons. One, it may be a ritual in your life. It may be what you do to unwind. Your partner comes home and you have a glass of wine together. Or perhaps at bedtime, you have a small drink to help you unwind. It's something we do when we go out with friends. It's something we do when we celebrate. You know, you can post something on social media about how happy you are, and your friends will say, well, where's the wine? Or I'm coming over bringing a red. So alcohol is really embedded deeply into our culture, and even so for women, more and more than it used to be. And we started noticing during the pandemic that many more people were drinking and drinking more than they had. And while it's understandable, I think that's a trend we'd like to reverse. You know, the pro-social aspects of alcohol can be undone. We don't have to make this the norm. If you try to drink less, you've got a really good excuse right now. All the pressure you're going to get from friends who probably feel a little bit criticized. That's one of the things we know is when we cut down on alcohol, our friends think we're judging them. So having a reason, like a health reason, that my doctor said, given the treatment I'm getting, I shouldn't have any alcohol, that can be really useful. And so I'd love to invite you to think about that as an opportunity. And then when your treatment's over, you can say, I realized how much better I feel. You can order a mocktail, you can order sparkling water with lime, and people don't necessarily have to know that you're not drinking. Or you can become somebody who's a convert and start lecturing to everybody about how they shouldn't drink, or show them this video. I'm not sure you want to be in the position of being a school marm. So that was mostly a joke, but I do want you to think about what purpose alcohol is serving and what are other ways you can have a ritual or a way to unwind. It can be a cup of decaf chai at bedtime or a small cup of tea. It can be all sorts of other things. You can make new rituals at home to celebrate the end of the day or something good that's happened. Let us know, what have you tried to replace your rituals related to alcohol? How have you found it when you lower your alcohol intake? How have friends coped with that and family coped with that? The last thing I want to say is if you believe that alcohol is a problem in your life, if you're thinking about alcohol during the day, if you find you can't cut back, if you're feeling excessively guilty about alcohol intake, there is hope. You can talk with your doctor, and without any judgment, they will make a referral and help you get some hope and some help with cutting down on alcohol. This is so prevalent in our society and worldwide. You're not alone. And yes, you can feel bad about yourself, but really the key is take an action. Do something to take the best care of yourself. I hope this has been helpful. Thanks for watching, and we'll see you next time.